In this video, we will explore consultations surrounding medication adherence. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. In our previous video on medication adherence, we explored the classifications of non-adherence, looking at unintentional and intentional non-adherence. In this video, we're going to explore how you can identify and then support your patients who may be experiencing non-adherence. When discussing medication adherence with a patient, it is important to remember that patients may not want to be completely honest or open with you when they are not taking medication in the way that you may have previously recommended. Therefore, it's important that you adopt a style and approach that is going to facilitate an open and honest discussion. In the UK, NICE makes the following recommendations to help identify and then address medication non-adherence. First and foremost, you need to adopt a consultation style that suits your patient. Remember, everyone is different and have different needs and requirements of you. This is all about building a rapport with your patient. Throughout any consultation, it's important we avoid jargon and medical terminology that the patient may not understand. This will obviously vary from patient to patient, but knowing your own patient and tailoring your language to their needs will help minimise any potential for misunderstandings. When you actually come to ask or talk about how they are getting on taking their medication, it is important to remember that non-adherence is the norm. About 50% of all medication is not taken as intended. Therefore, whatever they tell you and the way you ask it must be non-judgmental. Making it clear is the norm may help that process of that discussion. Whatever they tell you, be supportive. There is always things that the patient can identify and you can do to help them to take their medication in a better or improved way than they may already be taking it. A significant proportion of patients may be intentionally non-adherent. The only way to identify that is to understand their view of the world and identify their concerns and beliefs. Once non-adherence has been identified, any recommendations or actions and solutions must be worked up with the patient, i.e. we need to involve them in all the decisions about their care. That way they are likely to take more ownership of those decisions and therefore are more likely to carry them out. Try to resist making lists of recommendations and encourage your patients to come up with their own solutions. Be supportive and we should have more positive outcomes. Finally, before you finish your conversation about medication adherence, it is important to actively check the patient's understanding, i.e. get them to teach back, tell you about what they have agreed to do and what actions they are going to take. This will reinforce those positive behaviours and gives you opportunity to check that there are no remaining misunderstandings. Increasingly, patients are taking more and more medication. These medications need to be fitted into ever-increasing busier lives, and therefore there are a number of practical steps that you may be able to support your patients with in taking their medication correctly. Firstly, it's much easier to remember to take medication when it is linked to an activity you already do. Therefore, try to get patients to link their medication to things they're doing every single day. This could be meal times, could be routines such as walking the dog or brushing the teeth, or could be anything that the patient does that they automatically remember that you could link medication taking to. Some people will always need prompts and reminders. The increasing amount of medication they have to take means it is very challenging to know whether they have taken it all in the right way. Therefore, simple systems such as a chart that could be stuck on the fridge that people could tick through may be beneficial, or increasingly going to electronic solutions such as reminders or alarms on phones or electronic devices. All medication as standard is provided in child-resistant containers. For some patients, these may be challenging to open or access. And particularly with medical devices, such as inhalers or injection systems for diabetes, patients may have a trouble using these things effectively. Therefore, sitting down and working with a patient on how to use these devices and checking that they can pop out their medication or open the containers is really important. You can then identify sensible solutions to help solve whatever problems they may face, such as deblistering medication into a container without a child-resistant cap, or the addition of a compliance aid, such as an inhaler device that makes it easier to combine the breathing in with the pressing of the canister. Increasingly, medication compliance aids, devices that put medication in compartments where the days of the week and times of the day are divided, are used as a panacea or global solution to anybody who suffers from medication non-adherence. However, they are only really effective for patients who want to take all their medication, know the times of the day and days of the week, but just struggle about which medication to take when. They can then be a very helpful solution and aid memoir to taking their medication. In the next clip, you will see me having a consultation with a patient around their medication. See if you can identify any non-adherence behaviours the patient may be displaying. Also look out for the ways in which the practitioner tries to identify and then support the patient to improve their medication adherence. So just going back to the normal day then with those medicines, so start from when you get up, what would you normally do with your medicines?
So my iron tablets, I take those 3 times a day. So in the mornings, at lunchtime, and then evenings. Yeah, the brown inhaler. It's meant to be once in the mornings and once at night. But I've been recently not been doing that as much.
Okay.
Yeah, and the blue ones I just use when I'm doing exercise, going running and things.
Okay. And you mentioned there that the brown one you said you meant to be taking it. Tell me a bit more what you mean.
Well, I've had asthma since I was quite young. And it's quite good when I was younger, but now I'm not really seeing sort of the benefits of it. So yeah, therefore I kind of have not been taking it as well as I should be. And yeah, in the last month I haven't really been taking it at all, to be fair.
Right, okay. Just to complete your iron tablets, so you said earlier on you take those 3 times a day?
Yeah.
So that's quite hard to manage to fit things in 3 times a day. How do you get on with that?
Yeah, it's sometimes quite hard because I study at university, so my lifestyle's quite, it's not set each day, it changes. I'm not really in a routine. So yeah, it's kind of hard to remember when to take them and at the same time each day. So sometimes the middle dose in the middle of the day, I don't remember to take that because that's not when I get up or go to bed, that's meant to remember it as I'm doing something, and I sometimes forget.
Okay. So you sometimes struggle with the middle dose in the middle of the day. And how have you been getting on with the iron tablets? Have it made any difference to you?
No, I kind of actually feel still quite tired. Yeah, so I've been on them for a few months now. I haven't really seen any improvement in how I feel, my general sort of, if I feel sort of less tired. Still feel quite, lethargic and things.
So just talked quite a lot, so I just want to capture where we are. So we've got blue brown inhaler.
Yep.
Brown inhaler you haven't been using very much lately, if at all, recently.
Yeah.
And the blue one you've needed to use a few times a week. Okay. And you with the brown inhaler, when you were taking it, occasionally got sore throat with taking that one. And the iron tablets you take 3 times a day, but your university, lots of things going on, and sometimes that middle dose in the middle of the day,
hard to remember.
you find that hard to remember. Okay. So we've got a couple of things there that I think we should try and explore a little bit more.
Okay.
Okay, so I think you're doing a really good job. I think life at university is lots of things going on, and trying to remember to fit all your medicines in there can be challenging. The important thing is we want you to feel well and better, and you're still sounding like you're feeling tired, worn out, and so maybe the iron's not worked yet.
Yeah, I don't think it has, but I'm not really sure why.
Okay. How do you take the iron tablets?
I like to take it with a cup of tea normally, actually.
Right.
Yeah.
Right. So is that the morning one and the night one?
Yeah. So yeah, I just have a cup of tea, morning and night with iron tablets.
And might sound like a silly question, but I'll explain why in a minute. How do you take your tea?
Yeah, I have quite a lot of like milk in it. I like it quite weak.
Okay, so you've got quite a milky tea.
Yeah.
Okay. So let's just talk about the iron, because that's the one that you're feeling tired, and we want to try and improve that for you. So I think you'd said you'd had it a couple of months, and I think the last time when you started was a couple of months ago. And we normally like to wait 3 months before we can see a blood test to see the full effect of the difference. So I don't know whether the doctor's got a blood test planned for then.
Yeah,
check up.
possibly.
But we know we're sometimes missing a dose out, and also it's interesting that you say you take it with milky tea.
Yeah.
When we have iron with tea, and particularly milk, sometimes the way it is absorbed in our body, we don't get as much absorbed as we would like, because it links up to the milk and some of the tannins in the tea.
Okay.
So i.e. it's not working as well, you're not going to get as much as we expect you to get.
Okay, yeah.
Okay, did you know that?
No,
before?
I didn't know that, so that's interesting.
So what might help is if we don't take it with tea, and particularly milky drinks, and try and take it with some water.
Yeah.
And try and leave maybe a couple of hours before tea or milky drinks.
So, and is that a few hours before and after I've taken the tablet? Like, how long should I leave after?
A couple of hours would be ideal.
Okay.
Yeah.
Just to make sure.
Do you think you could do that?
Yeah, I think so.
Okay. Going back to your inhalers.
Okay.
You said you don't feel your asthma's. You don't take the brown one so often because you don't feel you need it.
Yeah, I just don't really see the benefit. Like, I feel fine when I've taken it, or if I haven't taken it, sort of thing.
Okay. Has anybody ever talked to you about why even if you feel fine, we think the brown inhaler might be important?
No, I've never really had, because when I was younger, I sort of got diagnosed when I was young. So obviously, probably they told my mum, but I've never really had that information directly given to me.
Right. Okay. So would it be helpful if I explain that?
Yeah, definitely.
To you. Okay, so what we'll do, I think it's worth us having a bit more time to talk through asthma and its importance, and possibly it might be that your asthma is improving and we may not need the brown one, but I'd rather do that with your GP, your normal doctor.
Yeah.
Okay, so we can set up an appointment to do that. Okay, well let's do that, and we'll do that at another time.
Okay.
Alright. In this video, we have explored how you can identify and then try to address medication non-adherence with your patients. It's important to remember that medication non-adherence is the norm, and therefore you must be non-judgmental when 1, asking, and 2, trying to identify solutions to potential problems the patient may have. Try to avoid coming up with solutions yourself, but involve the patient to help them identify the solutions that will enable them to take their medication as it is intended. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page, and subscribe to these videos.